Hello, it's Dr. Rhonda Johnson, and happy Friday. Today's July 7th, 2023, and today I'm talking about a finding that most American adults have immunity to SARS-CoV-2, that virus that causes COVID-19. Well, the June 2nd, 2023 issue of the CDC's weekly morbidity and mortality report estimates that 96.4% of U.S. residents ages 16 years and older have SARS-CoV-2 antibodies from either previous infection or vaccination. Now, in this article, the CDC scientist says that SARS-CoV-2 hybrid immunity, now that's immunity that you get from both previous infection and vaccination, provides better protection than that from either infection alone or vaccination alone. And the report notes that hybrid immunity prevalence was lowest among adults who were 65 years and older, and notes that that is the age group that is at the highest risk for severe disease if infected. That article also notes that hybrid immunity was highest among those ages 16 to 29 years of age. Now, I should say they made all these determinations through samples of blood donated in the United States during this study period. Now, there were some other important findings that in the discussion section of the paper, the CDC scientists noted that compared with vaccine effectiveness against any infection and against severe disease or hospitalization, the effectiveness of hybrid immunity against these outcomes has been shown to be higher and wane more slowly, meaning that if you've been infected and if you've been vaccinated, you have stronger antibodies protection that lasts longer. That's a simplification. Now, they also noted that this increase in seroprevalence in the United States, meaning that 96.4% of us have some level of antibody protection, is likely contributing to lower rates of severe disease and death from COVID in 2022 and 2023 than during the early pandemic. So I think there were a couple important points noted in this study. They note that vaccination provides some protection against infection. It also emphasizes that folks 65 years and up need to take the highest level of precautions and in terms of prevention of SARS-CoV-2 infection, particularly if they don't have hybrid immunity. It also showed that young adults have the highest level of hybrid immunity, and they're probably a group that's at high risk for reinfection, and that the CDC recommends that older adults stay up to date with recommended COVID-19 vaccination, including at least one bivalent dose. So if you've been wondering why, it looks like COVID is, quote, milder these days, it's not particularly that it's milder, it's that we are more immune. That's my message today. I'll include the reference to the article. And as always, I like to say, stay safe, folks. Be careful out there. There's still a lot of virus present here in our communities. Take care.